Bethany's got Dr. Jill and the Mobile Veterinary Clinic.
Yes, indeed. We always tell you that Dr. Jill is mobile. Look, here's proof. This is her beautiful new, and isn't it just shiny and bright, her mobile vet unit that can come right to your doorstep. All right, so let's pop inside. We've got a couple of great models this morning. Of course, Diva the boxer we know and love, and a little pointer fawn here. So, Dr. Jill, good morning to you. And I know it's the time of year that we want to talk about making sure that our pets get their annual checkups. So, are we wanting to go in more than once a year to see our veterinarian?
You bet. You know, especially when they're senior pets, twice a year is really the recommended amount of time you should be checking up. But if there's anything, any little lump or bump, don't wait for your annual physical. Make sure to have your pet checked out right away.
Okay, so with the annual physical, what are the things that we really want to make sure that our vets are looking into?
Well, you know, again, like if you look at Fawn here, she has a little tiny lump on her eye, and a lot of people miss these things. But we want our veterinarians to see them. I don't know if you can pan in and see that little tiny lump.
Yeah, I see it right here at the bottom
small,
part.
Right? And so a lot of people miss things like that. Your veterinarian should be able to pick up on things like that. They go nose to tail, check their heart, check all their organ systems. A good blood panel is essential, and especially a heartworm and a stool check every single year.
And you know, one of the things that might get missed because they're on the bottom of your pet's paws, they're little pads. Those little pads, they can have little problems as well. They can have little wounds on them, or even have disorders associated with their paws, right?
Right. You know, pads are really important. They're skin, so they can show autoimmune diseases, tumors, any kind of skin infection, yeast infections. So certainly, again, head to toe exams, really important. Make sure your veterinarian does all the way. You know, sometimes vaccine clinics don't do that. You get what you pay for. So go in, have your physical examination, have your veterinarian vaccinate. Good quality vaccines, really important.
Oh, these guys are being so well behaved. They were out getting a little run in our parking lot earlier. Good morning, you two. So with your mobile vet, who's a good candidate for you actually driving this thing and parking it outside their house?
Well, you know, we have all sorts of people. We have handicapped clients, for example, people who can't get into a veterinarian, actually handicapped pets. I have some animals that are in wheelchairs, or ones that can't walk. We have people that can't lift their pets up. Animals that are very scared or shy, they have a better time just coming into the mobile unit. Sometimes just avoiding that drive. A lot of animals don't like the automobile. Walking them out and just into the truck, they do marvelous out here. It's just like a little vet hospital on wheels.
Yeah, no, it really is, and it's beautiful, and she's perfectly set up. And of course, you even have some cute little ones hanging up from the top, so the doggies can maybe have some friends so they don't have to be nervous. All right, Paul, we'll send it back into you, and I know that you've got all the information for how folks can get in touch with Dr. Jill.
Of course I do. To schedule an appointment with Dr. Jill, check out her website, drjill.com, DRJYL, or give her a call. The number's on your screen, 916-989-0738.